My name is Fallon. I am a second year intern currently at Grooteskier, and I studied medicine. I started studying medicine when I was 32 at Stellenbosch. And prior to that, I had done an undergrad and honors degree in biokinetics. Originally, I was from Joburg and moved to Cape Town to do my biokinetics internship at the Sports Science Institute. Yeah, and haven't left. BSc physiotherapy wasn't obviously going to be viable, so I got into a BA sports psychology at University of Johannesburg and did very well, and I absolutely loved it, and I just found that I was gravitating and enjoying more of the sciences and the human sciences and physiology, which obviously the human movement module comprised of different subjects. And then I got into an honors program in biokinetics. And I think it really came to the fore when I did my internship at the Sports Science Institute, because there was quite a big clinical component to biokinetics. So I was fortunate enough to work under sports physicians and doctors dealing with patients, that had gone through MIs or sort of cardiac issues and had clinical medical conditions that required biokinetics treatment. And it was just kind of from there a tap dripping. You get into the rut of working and providing for yourself, and the thought of going back and studying full time, it sort of seems further and further achievable, or further away to achieve. And then it was just eventually at that point, I just thought, well, I'm just going to apply and park it, and never thought that I would actually get in. And then when I did get in, it was sort of like, well, now I have to do this. And so, yeah, that's what it wasn't. I wouldn't say that I had a desire to be a doctor from a child. I actually couldn't stand the sight of blood or anything like that, weirdly. But it was just through working in an environment that was a little bit more clinically based with sports physicians and doctors, that I kind of, decided that I wanted to work in a hospital and be a doctor.
Okay. So if I can just ask, why did you choose to do honors in biokinetics?
So like I said, I'd originally wanted to do physiotherapy. I was always quite sporty and quite a competitive swimmer. And so I had received a lot of physiotherapy and biokinetics treatment myself. And, the two are quite closely linked, and so I didn't get into physiotherapy. And at that stage, biokinetics was you had to do an undergrad degree either through the BA route or a BSc route, and then it was a 1-year honors degree. I think it's changed now. It is a 4-year degree now, but back then it was an honors program with a year's internship. So I'd always, been interested in it because I had been sort of a patient of it myself. And it's quite broad. You can do, there's the orthopedic component, there's a chronic disease component, there's a sports component. And so it just was very appealing to me, and obviously not being able to do physio, it was kind of like the next best thing that I felt interested in.
Okay. So if I may ask, were there any challenges that you faced in sort of when you wanted now to decide to go do medicine, in the sense that most of your peers were going into the workplace and you're sort of going back to becoming a student?
Yeah, sure. No, very much so. I mean, first, it's almost impossible to get into medicine as an older student through a lot of universities. I mean, UCT, 95% of the time only take matric students into their programs. Wits, it was almost impossible. And it was just through Stellenbosch. They've got a different application process, where they look at sort of what you've done, as a person. It's an interview. It's not based on academics. I mean, obviously they look at your academic history, but it's not like those NBTs. So the first challenge was just sort of trying to get into medicine as an older student, because like I said, a lot of the universities are, they only look at matriculants. But definitely so. Yeah. I mean, I was 12 years older than people that I was in class with, so there were two components for me. One was obviously trying to relate to a generation that was completely different. When I had studied previously, it was pen and paper. And when I arrived in for lectures, everything was online. People were working off laptops and iPads. So that was technologically, I had to get with it, And then also like personally, because a lot of my friends were in a different space, they were getting married and having kids, and now I was going back to studying. So it became quite difficult to socialize with people because my commitments now were to obviously I have to study, or, I'd have to be at hospital. So my social group became smaller and smaller. And I mean, I've had a very supportive family, but I could say that the same challenge applied because your time is just completely dedicated to studying.
So I just wanted to ask, now like having to study medicine as an older student, what are the advantages of that, in the sense that, is it easier now in the sense that you already know how to study, you already know what works for you in terms of studying, or like
Yeah.
what are the advantages?
So I think, I mean, I always say to people that if I had to have studied medicine as an 18-year-old, I would have never survived. I think it's a very highly pressured degree that doesn't allow for a lot of mistakes. And obviously, because I always felt time was against me, so there was just no option of failing a module or not passing. So I had a lot of pressure on myself with that. But the benefits of being an older student is I know that it's what I want to do. So I wasn't there trying to figure out life per se, which I feel is quite sad for a lot of the kids. I call them kids, but I mean sort of, the people, my juniors, because they don't know what I mean, I still sort of felt like I had a wholesome undergrad student life. You can socialize and get involved in the university stuff. Whereas I think a lot of the students that do medicine, if they do that, some don't make it through because the degree is just so intense. So I think they struggle with that balance. Whereas as an older person, I was a lot more focused. I knew that I had to pass. I wanted to pass. I wanted to, get into being a doctor.
Yes.
And obviously I understand how to study, what's required at a tertiary level to study. And then also just some life experience. You have experience on just dealing with things and life, and perhaps, a lot of these kiddies don't really have that yet. So I think they struggle a little bit. So definitely, as an older student, I still think actually that medicine should only be offered to people that have either done an undergrad in something else or of a certain age.
Okay. So like, if I may ask, in terms of like having to now like adjust to being a student amongst like junior students,
yeah,
like how long did it take for you to get used to the idea of being around the younger students? And like, were there also like older students that were studying that sort of like you guys related and made the whole journey easier?
Yeah, definitely. Yeah, I mean, it took a long time, I won't lie. It probably, because you feel a little bit insecure. You feel like, sure, these people are judging you because you know what you're doing with your life, and you're so old. So it took me probably until I started getting into like the clinical environment where you actually have to mingle with people, in your small groups. So probably in third or fourth year. But up until then, I felt very sort of insecure because you just feel judged a little bit. And naturally, I did gravitate towards the older students. At Stellenbosch, there were only, I think there was only 17 of us. And I think 4 actually sort of dropped out. But we had our own sort of group, and just naturally we gravitated towards each other. You just kind of spot someone that doesn't look like they're 18, and then figure that they want to you. Yeah.
Okay, I see.
Yeah.
So let's say to someone like who's in a similar situation, maybe they studied something else, did honors, maybe they are working now, and they always like had that desire to want to do medicine. Like you've mentioned that having to study medicine as an older student, you now like knew like you really want to be a doctor, and like you knew what you wanted. You are more motivated like to want to be a doctor. So to someone like in a similar situation, what advice can you give to them? Maybe like they're in doubt, should I really go do medicine? What advice do you give them to navigate those feelings?
I think that's the first red flag, is that if you're doubting whether you want to do it or not, then it's probably not the right time. So I think if it's something that you've kind of wanted to do and just maybe haven't had the finances, or you haven't been in a position to do it, then I think my advice would be is there's always a way. You just have to find how you're going to manage to do it. The biggest thing I guess as an older student is also financially, how do you support yourself while studying, because the degree is full time. I was just fortunate that I obviously ran my own practice. So I did work, but my hours were my own. So I could choose when I worked.
Yes.
So I think that's the first thing. But I think if somebody's questioning whether they actually want to do medicine, that's a red flag. And you can't go into it feeling like that. It's going to spit you out. And I think the biggest thing is probably not actually getting the studies done and getting the degree done. It's more the 3 years afterwards that you have to work, as an intern and conserve. And to be honest, that's probably the part that I've struggled with more than actually being a student. I think that's been really difficult to go into these really hectic work hours, also going back into an environment where I'm the bottom feeder, like I'm the juniorest level in the hospital, and working with people that are probably younger than me, but much more senior. And so that's actually been a lot more difficult than physically studying. So my advice would be to somebody that you absolutely have to 100% know that it's something you want to do.
Okay. Yeah, so because I also think like a lot of people they don't really like consider like what does it actually mean to study medicine, like how long is it? They just have the idea of,
Exactly.
like, I love learning about the human body, so I want to do medicine.
Exactly. Yeah, no. It's
Okay.
a massive sacrifice, and it's a lifestyle adjustment that's very, very it's a big sacrifice.
Okay.
Especially if you have a family, I mean, I'm single, I'm unmarried, I don't have kids. So I've only had myself to worry about. But my clinical partner, who is my best friend, he's married, he's got 5 kids, and so his sort of experience going through it was a little bit different to mine.
Okay, so I just want to ask, I heard you mention that at Stellenbosch, like there's an interview, like when you're applying like as an older student. Do you mind just maybe explaining that process, like as an older student, how is the like application to transfer at Stellenbosch into medicine?
Yeah, so I mean, I don't know if it's the same now, but when I applied, it was if you had completed a degree before, then you didn't have to write any entrance exams. Your application process started off with a letter of motivation, and obviously your documents to verify that you had completed a degree. And then from there, they selected, I think it was, I can't remember, but I think it was 50 people were selected, and then you had an in-person interview. It was a panel of 3 people at the university that interviewed you, and then from there they selected, I think it was 18.
Okay. So, last 2 questions. So what would you say like it's your grinding motto or a quote that you live by that allows you like to remain focused, get the job done, and like stay focused on your goals?
Yeah, I think especially now where it can be you question if you've done the right thing just because the environment is so pressured for me, and it's maybe not always seen in the most positive light, but everything is just time and it will pass. So if it feels like it's unachievable or it's just unpleasant, everything is just time and it will pass, and everything that is difficult is always worth doing. It always, and when you look back retrospectively, when something was the most challenging, it always gives you the most reward. So yeah, I guess for me, it's always just everything is time and it will pass, and anything that is hard is always worth doing.
Definitely. So, as a last question, can you maybe tell us like what are you looking into specializing into after your internship?
Yeah, I mean, sure. I'm so old. I'm like, I don't even know if I have the energy, but I would like to, and I don't know if I will. I think it will depend on how next year goes, and obviously it's so difficult to get into specialities. In post, it's very competitive. But my dream would be to be an emergency medicine doctor. So I love working in the front room, particularly trauma. I don't really like surgery. That's why I don't know if I will do that, but definitely emergency medicine.
Okay. Yeah, thank you so much for your time, taking time from a busy schedule to
I know, shame, and I'm so sorry I had to reschedule and I couldn't meet you in person. So sorry.
Nah, it's okay. Online also works as well.